All right, hello and welcome. This is the FDA workshop on the Retail Flexible Funding Model. We're going to get started with a few tips for using the platform during the meeting. Amy, could you please play the tips and tricks short video?
When you are attending the session, you have the ability to engage with fellow attendees via the chat box directly on the platform. On here, you can add additional comments or ask questions to the speaker, as well as see comments from other individuals. You can also reply directly to an individual's comment. In this same space, you will see the Polls tab. Here, you can participate in any polls that the speaker may have put together for their presentation. Please note, if there is no poll here, then one has not been created for the session. The Files tab will show any documents that have been uploaded for you to view and/or download. Lastly, the People tab will show you any individual who has added this session to their agenda. Lastly, if you are still experiencing any challenges or need tech support, you can click on the Support Desk tab in the navigation bar. In here, you will see a button to enter a live support room to talk to someone during the designated hours. We hope you enjoy your conference experience.
Thank you, Amy. Well, we have an incredible amount of information to share with all of you today. Please look at the workshop tab and download the templates to follow along with the presenters. Please also put your questions in chat on the Pathable platform. We're going to address as many as we can and save the chat. We are also extremely grateful to have 3 subject matter experts who are here with us today who will answer your questions throughout the session. Donna Wanucha and Katie Kennedy are both retail food specialists in the Office of State Cooperative Programs, and Maribeth Neeson is a consumer safety officer for the Office of Partnerships. They are ready for your questions, so please add them. All right, let's get started. Our first session is how to create a comprehensive strategic improvement plan. It is my pleasure to introduce our presenters for this session. Becky Steiner and Katherine Del Mundo are both retail food specialists with the Office of Cooperative Programs. I'll hand it over to you, Becky.
Good morning. Thank you, Tracinda. I'll be doing the first presentation. Okay. Can I just confirm that you can see my screen, Tracinda?
Yes, we can.
Awesome. Okay, welcome everyone to the 2021 FDA Retail Food Seminar Workshop. So we'll be kicking off the workshop with a presentation on how to create a comprehensive strategic improvement plan, or CSIP for short. The plan for this presentation is to make the concept of a CSIP as easy to understand as possible to help jurisdictions with their planning. Before I begin, if anyone has any questions during the presentation, please feel free to put them on the Pathable chat. We have team members, as Tracinda mentioned, that will be monitoring this chat. And at the end of the presentation, we have a short Q&A portion where we'll go over the questions that are posted. If we don't get to your question today, please don't worry. We are keeping track of all the questions we receive, and we will be sending out a Q&A to all the attendees shortly after the seminar. There's also a dedicated FAQ portion of the presentation that may already answer some of your questions. So with that said, let's go ahead and dive into creating a CSIP. So these are our objectives for our presentations today. First, we will review the purpose of the Retail Food Program Standards and how it relates to your retail food program. Next, we'll discuss what a CSIP is and explore the benefits it has to planning the work in your retail food program. We'll also go over the eligibility criteria for both the development and the maintenance and advancement-based boxes of the Retail Flexible Funding Model, or RFFM for short, and how the CSIP relates to them. Next, we'll discuss how the Retail Program Standards relates to the basic steps of a strategic planning process. And last and always the fun part, we'll go over and have a small activity using CSIP example scenario templates that you can use. So something to note, it is possible you already know what a CSIP is, but call it a different name in your organization. It could be referred to as an operational plan, a long-term plan, tactical plan, master plan, or organizational strategic plan. I think as we go along this presentation, you'll realize that maybe your organization is already doing this planning process, but using another name or not using a name at all. One thing to think about as we go over the presentation and the activities today is what can you leverage from the current work that is already being done to develop a CSIP for your RFFM application. So an example would be the Public Health Accreditation Board or FAB accreditation. So let's do a quick poll question. Crystal and Amy, can you go ahead and post it up? So the question is your jurisdiction enrolled in Public Health Accreditation Board or FAB accreditation? Okay, so I see some of the answers. So a lot of you, 53% of you said yes. So from the poll, it looks like a lot of you are familiar with FAB, and more specifically, you may be familiar with FAB Standard 5.3, which requires a health department to develop and implement a health department organizational strategy plan. So if this is something you've done, then you may already be familiar with how to create a CSIP. The difference between FAB accreditation and a CSIP for the RFFM is that the FAB strategic plan focuses on the entire health department, whereas the CSIP requirement with the RFFM is specific to your retail food program, with the intent to advance conformance with the retail program standards. So now next, let's review the purpose of the retail program standards. So the program standards serves as a guide to regulatory retail food program managers in the design and management of a retail food regulatory program and provides a means of recognition for those programs that meet these standards. The standards are designed to help retail food program enhance the services they provide to the public. So when properly applied, the retail program standards should help programs identify areas for the greatest impact on retail food safety, promote wider application of effective risk factor intervention strategies, identify program areas most in need of additional attention, provide information needed to justify program budgets, lead to program innovations, and improve industry and consumer confidence by enhancing uniformity. So the retail program standards are about more than just meeting individual standards. They serve as a model for continuous improvement and maintaining conformance over the long term. So following the initial self-assessment, the complete self-assessment cycle must be repeated at a minimum of every 5 years or 60 months. The self-assessment gives the jurisdiction an opportunity to conduct an internal review of existing retail food program accomplishments and compare against the criteria of the retail program standards. Conformance is measured through repeating verification audits of those standards once they are met. So FDA always encourages enrolled jurisdictions to actively participate in the retail program standards. Active participation means that a jurisdiction takes action to periodically assess its programs using the criteria in the 9 retail program standards, have its self-assessment verified by an independent audit for standards that the jurisdiction reports meeting in their self-assessment, and report the status of the program self-assessment and verification audit to FDA. So the goal of FDA's National Retail Food Team is to assist state, local, tribal, and territorial jurisdictions from moving beyond the point of enrollment in the retail program standards to making significant conformance with the individual standards. And this is where a CSIP comes into play. So what is the purpose of having a written CSIP? So a written CSIP is based on the results of a completed self-assessment and documents measurable continuous improvement with the program standards. Essentially, the written CSIP is a long-term, multi-year project plan that guides the work of the regulatory retail food program towards meeting the requirements of the standards that are not met. The plan may also include tasks related to maintaining standards the program do meet. Overall, the benefits of having a written CSIP include the ability to set up a sense of direction. So this will allow programs to be more proactive than reactive, improving the ability to obtain resources and enhancing program sustainment, increasing operational efficiency, which assists in not wasting time or duplicating resources, providing motivation for staff by promoting goal achievement, and allowing flexibility to address roadblocks. So this slide demonstrates the basic steps of the strategic planning process, which is the blue inside circle, and the corresponding retail program standard elements and RFFM requirements, which are the black text outside of the blue circle. So the retail program standards fits well with the CSIP framework of the RFFM, and what this slide demonstrates that it is not necessarily extra work, but creating a more clearly defined roadmap to success. This process is streamlined with the requirements outlined within the administrative procedures and each standard of the program standards. Because the CSIP is supposed to be a long-term multi-year project plan, it is flexible with timelines set by the project team. So this means that the timeline can be adjusted as necessary to meet the program's needs and resources. So as you can see, CSIPs are vitally important with or without funding to assist your retail food program with making progress with the retail program standards. So just a quick review of when a CSIP is needed for the RFFM. A jurisdiction must have a completed self-assessment and a written CSIP to apply for development-based box funds, specifically to work on continuous improvement and a public health metric, which falls under track 2, as well as all funding opportunities in the maintenance and advancement box and optional add-on funding opportunities, which fall under track 3. So now let's talk about the key components of a CSIP and basically what a CSIP must have. Remember, whether applying for funding or not, jurisdictions should develop a CSIP based on results of their completed self-assessment. Again, keep in mind that the CSIP is a living document and the timelines within it can and should be reevaluated as needed. The intent really is to create a plan to provide direction. So the CSIP should answer questions. The first question to ask is, where do we want to go? What is the mission and goals of your retail food program that is identified through the program standard self-assessment? Be sure to maintain focus on priorities and integrate strategic work into your program's daily activities so that the strategic priorities do not become burdensome to staff. Both should actually blend together. Next, what are we doing? So what is the specific action step or task you're going to complete? This is the specific strategy to accomplish the goals identified in the first question of where we want to go. This is also where key resources are identified, direction is set, and the team is aligned. This should include all standard elements not met in the self-assessment and may also include tasks related to the maintenance of standards that have already been met. The next question to address is who does what? Here you identify key personnel responsible for carrying out specific tasks. This is the step where your value network is established, such as program management, key employees like your training standard and program standards coordinator, stakeholders, and board members. Basically, you're creating ownership throughout the plan, and it drives collaboration and is a foundation for strategic dialogue to adapt to changing internal and external conditions. Next, we need to think about when will action steps be started and completed. Here you specify target completion dates for each action step or task. So outlining a roadmap for all collective action steps or tasks within the plan will make sure that adequate resources are available at each step along the way and the program is not overwhelmed at any given point. Now keep in mind that the CSIP covers multiple years of work on the retail program standards and may extend past the requested funding period. One thing to also note, for those of you that are seeking funding to complete a risk factor study or equivalent, the CSIP must specifically address a time frame for its completion. And finally, the last question the CSIP should address is, how did we do? A method of tracking performance and measuring success is important to the process to know if your goals have been achieved. The CSIP must describe how to define measurable improvements and measure progress of the work you are doing. So here on this next slide, you can see a template for drafting a CSIP. This template is just an example of how you can construct your plans and what to include. It is intended to serve as a resource that you can use. There is no one right way to develop the CSIP. You can use other formats and templates to construct your written CSIP that best meets your need. So next, let's go over the example CSIP template together. So let's look at the top part of the template and briefly go over what they are. This is your general information. It includes jurisdiction, which is the name of your regulatory retail food program within your agency. Program standards lead, which is the name of the project manager responsible for the oversight and implementation of the written CSIP. Program standards support team, which includes the names of both internal staff members and external support contacts that are responsible for the completion of action steps or tasks within the written CSIP. And finally, last reviewed, which is the date the written CSIP was last updated. Again, the plan should be viewed as a living document that will evolve and change over time based on the priorities you have set. So having the last revision date is always helpful to ensure you have the latest one. Next, let's discuss standard criteria and what that means. So standard criteria provides a link to the specific standard criteria that relates to the deliverables and action steps that are outlined in your CSIP. Here, you will enter the standard criteria number reference, which is taken from the program standards self-assessment and verification audit form. So for example, if a jurisdiction is working on conducting a risk factor study as part of meeting the requirements for Standard 9, the standard criteria reference numbers that would be entered would include 1A, 1B, and 1C, which is taken from the self-assessment and verification audit form. Next, let's discuss deliverables and action steps or tasks and what they are. So using the same example from the previous slide, again, 1A, 1B, and 1C is entered into the standard criteria box. Remember, again, these were taken from the standard criteria number from the program standards self-assessment and verification audit form. The deliverable portion is a brief description of the objective or outcome that you are attempting to achieve. So in our standards 9 example, the deliverable is to conduct a risk factor study collection for fast food and full service restaurants. Next, the action steps or tasks is the description of the action steps or tasks needed to achieve the deliverable. There may be more than one action steps or task needed to achieve the deliverable, so you would enter one activity or task per line. So using the standard 9 deliverable as our example, the action steps or tasks needed to complete a risk factor study data collection for fast foods and full service restaurants might look like the green, yellow, and gray colored sections as shown on the slide. All right, guys, so let's do a little quiz. So using the poll function on Pathable, what CSIP components do you think are covered in this section? Remember, the CSIP components are where, what, who, when, and how. And there may be more than one answer. Okay, so I see the answers coming in. So this section covers the where component, which is the deliverable, and the what component, which are the action steps or tasks. So great job for those that selected those two. Okay, so next, let's discuss the remaining section of the CSIP template. So individual lead is the name of the program support team member responsible for the activity or task. Target completion date is the projected milestone date for completing the activity or task that's identified. Remember, the CSIP is a living document, and this target date is anticipated projected date. This is different from the start date, which is the beginning date for starting the action step or task, and the completion date, which is the date the action step or task was completed. And finally, this CSIP template has a comment section which is an optional field to provide the user space to enter additional information that may be relevant to the action step or task. So again, let's do another quiz. What CSIP components do you think are covered in this section? You can put your answers in the chat in Pathable. All right. So great job, everyone. So the individual lead answers the who question, and the start and completion dates answer when. So again, great job. Okay, so the final part of the CSIP template is to specify how you will measure progress. So this CSIP template, for example, provides a color-coded legend to visually track the status of the activities. The action steps or task column can be color-coded to reflect its current status. So our final quiz for today, what CSIP components do you think are covered in this section? Okay, so it's up on the poll section. Awesome. So 76% said how, and that is correct. This last section answers and covers the how component. All right, so now that we've done an in-depth dive on how to create a CSIP, let's do an activity. I'll be handing it over to my colleague, Rebecca Steiner, and she'll be going over the activity with you.
All right, good afternoon, everybody. Let me get this pulled up here. All right, and could I just get confirmation that you guys can see my screen, Tricinda or Katherine?
Yes, I can see it.
Awesome. Okay, great. Thank you. Let me minimize that. Sorry, I'm fixing a window here so I can see. Okay, so thank you, Katherine, for that excellent introduction to all things CSIP. So now that Katherine has walked us through a comprehensive strategic improvement plan template, the template and the background of what the RFFM requires for a comprehensive strategic improvement plan, and the benefits of planning, let's apply everything we've learned so far to an example scenario. So Tricinda has already mentioned where you can find the example blank template in Pathable, the seminar platform under the workshops tab. And I did notice that some people have also posted a link in the Pathable chat. So thank you very much to those who did it. So if you would like to download it and follow along, please do so. So just a few things to consider before we look at the activity here in a few minutes. The first thing is to remember that this is only an example. So we do understand that every jurisdiction that is reviewing this template is operating in its own unique program environment. And as such, there is no one right method or approach to developing a written CSIP. So jurisdictions should develop your own action steps and tasks that meet your specific program needs and your available resources. In the scenario that we're going to look at, the example jurisdiction has decided to include items from their self-assessment where they already met certain elements of the standard criteria. So you'll see in the upcoming slides that those items will be highlighted in green and noted as completed. So if you are an attendee here today, even if you have not met any standards, this should still be helpful for you, no matter what stage of progress you are in the retail program standards. if you're newly enrolled, or even if you have yet to complete a self-assessment, you're still going to want to pay close attention, because you can request funding under the development-based box of the RFFM to complete a CSIP. And then, as always, with all things retail food, if you have questions or you need technical assistance with developing your CSIP, please reach out to your FDA retail food specialist as a resource. So for this example scenario, we're looking at this hypothetical jurisdiction, and we're calling them Cactus County. And so here's some background information to help give context. So I'd like to highlight some background info about where Cactus County is with the retail program standards. So they enrolled in the program standards in 2015, and they completed their first self-assessment in 2016. And then this year, in June of 2021, they completed an updated self-assessment of all 9 standards, which put them into their second self-assessment cycle. So based on the results of their updated self-assessment of all 9 standards, Cactus County has developed a comprehensive strategic improvement plan that spans 6 years. And this essentially is their project plan that's going to guide their work toward meeting the requirements of the standards that they have not met. From their self-assessment, Cactus County has determined that their short-term priorities over the next 1 to 3 years include maintaining conformance with Standard 7, and this is something that they'll be doing each calendar year. They also want to develop procedures and policies to achieve conformance with Standard 3. And they also would like to complete a risk factor study that includes the development and implementation of intervention strategies for restaurants, retail food stores, and healthcare and school facilities. And they are splitting up their data collection and data analysis by industry segment over the next 3 years from 2022 to 24. So the approach that Cactus County took when developing their CSIP was to outline a more generalized and simplified approach overall. Their CSIP does provide some contrast between the longer term deliverables that are further out in their plan. Those are more broad in scope, versus the shorter term deliverables that are more immediate in their plan, years 1 through 3, which contain a little more detail and clearly defined action steps. So those longer term deliverables that were 2025 and beyond, years 4 through 6 of their plan, they did not spend too much time outlining specific details of those deliverables, because they recognize that those longer term items may be subject to change over time. But for the shorter term deliverables for the next 1 to 3 years, they did put more detail into that, because they anticipated they would likely submit a project implementation plan for funding support as part of the RFFM application. So that's the pro to listing out a very specific level of detail in your CSIP and getting into the tactics, is that the more detail you put in your CSIP, you can carry many of those action steps and tasks over to your project implementation plan for your grant funding request. So for those attendees who received information about the optional pre-workshop exercise, if you were able to complete it, you may have already gone through the blank CSIP template and filled out some action steps and tasks based on priorities that were identified in your own self-assessment. So this may look somewhat familiar to you. Here what you see. If you did not complete the pre-workshop exercise, do not worry. It's not a prerequisite for this presentation at all. What we're going to look at in this example scenario from Cactus County with the sample action steps is to break down some elements of their plan. There's nothing that you need to complete right now. The activity here for you is just to follow along. So jurisdictions may choose to include items that they've already completed in their CSIP, which is what Cactus County did. And this is where they've already met the standard criteria. This can be helpful for tracking to ensure all elements of the standard criteria have been met, and also to quickly reference the next steps in the process. It may also be helpful for reporting to stakeholders and decision makers of the key activities that you've completed and your program accomplishments. In this particular scenario, the completion date column is blank, since these items were completed by the jurisdiction prior to developing their CSIP. Cactus County has some additional elements from Standard 3 that they need to continue working on in order to meet the standard. So this slide shows an action step for Standard 3 that's color-coded in yellow. This means that that action step is currently in progress. And they've also outlined some action steps that they color-coded in gray. This means these items have not been started yet. When you're looking at these examples, the timeframes in the examples are specific to our hypothetical jurisdiction, Cactus County. So you might look at these target completion dates and wonder how these targets were selected or identified. Just keep in mind that whenever you're setting your target completion dates for your own comprehensive strategic improvement plan, that whether you are representing a one-person jurisdiction at a small county or you're a large jurisdiction in a metro area with a large program standards planning team, it's important that you establish a roadmap and a timeline that's specific to your unique situation and that's based on your available resources and staffing. Consider your CSIP a living document, and it's important to consider a roadmap that will help you focus your efforts of continuously improving your retail food program. So your course of action may need to change direction from time to time, and that's okay. Stay flexible and adjust as needed. So in this example for Standard 7, you'll again see the activities that Cactus County has already completed, and those will be highlighted in green. As discussed previously, Cactus County feels that it's helpful for them to track their progress with meeting all elements of a standard. Although Cactus County has already met Standard 7 and they've had their verification audit conducted to confirm that they meet it, they've mapped out future activities that they will conduct in order to maintain conformance with Standard 7. So you're going to see here that Cactus County has marked some action steps and tasks as in progress, and those are highlighted in yellow. These are the actions that they're planning to conduct in 2022 as part of their ongoing work for Standard 7. They've also specified in their CSIP using the comments field that they're going to conduct this action each year of their self-assessment cycle in order to maintain conformance with the standard. So as you can see with their CSIP, Cactus County has outlined some key strategic plan components. So they started out by listing the standard criteria, and this serves as the objective for their strategic plan. Essentially, it set the direction of their plan and answered the question, where are we going? Next, they outlined the deliverables of their CSIP, and this was the goal setting stage of their strategic plan where they set their operational performance goals. Here they answered the question, what must we accomplish? From there, once they had their deliverables established, Cactus County outlined the key action steps and tasks to meet those deliverables. And this is where strategic choices were made to achieve their objectives and goals. This is the part of their CSIP where they outline who does what and by when. And then finally, Cactus County specified a way that they were going to track progress in their comprehensive strategic improvement plan. Their measures included identifying individual leads and completion dates for each action step, and they're using a color-coded key to monitor progress with their plan. So here's the part where they answer how success can be measured. With the retail program standards, this can also be accomplished using the self-assessment and verification audit process. And a retail food program can also define additional performance metrics to measure progress. So there are some things you're going to want to consider when you're putting together your comprehensive strategic improvement plan. One of the most important things to keep in mind first is you do not have to do everything at once. During our next workshop that's coming up on creating a project implementation plan, you're going to see an option to track action steps and tasks with a Gantt chart, such as what you see displayed here. This is a really helpful visual of your project elements displayed by time, in this instance by quarter, and is helpful to see where you may have overlap in your comprehensive strategic improvement plan activities or actions. This can assist you with planning to ensure that you have sufficient staff and resources at any given time to accomplish your goals and objectives. So that leads into the second consideration, is available staff and resources needed to accomplish your goals. You'll also want to think about staff and resources that are outside of your immediate program that you will need to work with. For example, public information officer, epidemiology, IT. You'll want to take their availability into consideration when planning, and you may also consider trying to secure the placement of an environmental health or public health intern to assist with various projects. You may want to think about your other workload assignments as well that could impact your goals and objectives. For jurisdictions in attendance today that manage multiple program areas, be sure to balance your action steps and tasks in your CSIP with what's occurring across other program areas. And you know those can vary by season or year. Finally, think through overarching organizational priorities. And these priorities can come from upper management or even external to your organization, but they can impact your resources, your staffing, and your timelines. So you'll want to take these into account when you're planning your activities for your retail food program. So I'd like to discuss a testimonial from a jurisdiction that's currently enrolled in the retail program standards, who has some firsthand knowledge about the planning process that I'm hoping by sharing their story can be helpful for other attendees. So this jurisdiction is a county health department from a large metropolitan area, and they have been FAB accredited, Public Health Accreditation Board accredited since 2015. And as such, they've woven the retail program standards progress into their last two organizational strategic plans. So in a conversation with their program manager discussing their process of planning, their program manager said it helps to keep them focused where they have short-term goals and long-term goals to meet the standards. He also said that using the SAVA gap analysis tool helped to lay out action steps and tasks so that they could see the progress they were making along the way. And that if they were really close on one of the standards, such as standard 3 or 7, they could concentrate on that and work to meet that first, and then focus on other standards, like maybe standard 1 or 5 later, that may contain longer term action steps where they may need board approval on an ordinance change. He also relayed that it's important to understand the nuances of all the individual standards so that you can know where they tie in together. And this is where the self-assessment of all 9 standards helps, because it gives you a chance to see where your program currently is in relation to each standard. And finally, he communicated that having a strategic plan and tracking progress really helped with reporting their program activities to their director and their board of health to show them all of the work they were doing and the progress they were making with the standards. So before you get started, before you develop your CSIP, the first important thing you need to do is complete a self-assessment of all 9 standards. This gives a framework to start with because it provides a comprehensive baseline review of your food safety program, and it helps identify the gaps using the retail program standards. There, using the gap analysis from your self-assessment, you can then identify your program needs and establish program priorities and plans to address those needs as resources become available. Another tip to help get started would be to pair up with a mentor, and you can do this formally and apply for RFFM mentee funding under the development box prior to even having a CSIP developed. So less experienced jurisdictions can benefit greatly from participating in the mentorship program as a mentee, where they can receive assistance from a more experienced jurisdiction who can provide knowledge and guidance in their areas of need. Another tip might be to form program standards networks with other regulatory partners for the purpose of sharing information and resources. This can be helpful for jurisdictions of any experience level because learning from our peers through sharing ideas and strategies can be a valuable approach to foster innovation. So engage your retail food specialist to assist with bringing jurisdictions together and utilize Food Shield as a platform to form a group where your network can share resources and materials and collaborate and communicate together. And finally, utilize the optional templates that are available. And you can use these to assess your priorities, your timelines, and your capacity. We've got the blank comprehensive strategic improvement plan template and the blank project implementation plan template. These blank templates are provided examples and are available in the seminar platform under the workshops tab. They're also on the NEHA application portal itself, on the grant portal, and your retail food specialist can provide them to you as well. Again, it's important to note these are optional templates. They're not required for you to use. If you have something that better fits your needs, you are free to use that. So we have spent a lot of time talking about a CSIP in preparation for our next presentation that's coming up on a project implementation plan. I would like to review that all RFFM applications for funding do need to include a budget justification and a detailed plan of work. So a detailed plan of work is required for all applications. And while the CSIP itself is a detailed plan of work for your retail food program, the optional add-ons in the RFFM specifically also require the project implementation plan because those projects may not be detailed in your CSIP. So our next presentation will review this in more detail. Essentially, your project implementation plan is going to be your project outline that you're going to submit with your application for funding to explain how you intend to use the RFFM grant funding. If you're applying for funds to work on continuous improvement with the retail program standards, many of the elements that are in your CSIP can carry over to your PIP. So now we're here at some commonly asked questions that we've received so far. And I can't see the Pathable chat right now while I'm presenting, but maybe some of these have come in through chat. I don't know, but I'll go ahead and go through these. I'm sure some of you may come up with these questions in the future if you haven't already. So one question, the first one is, I'm applying under 1 year development funding to complete a CSIP. So are my feet going to be held to the fire if I don't stick to the elements of the CSIP? Or in other words, are the timelines in the CSIP fixed? So the short answer to that question is no. Again, remember that the CSIP is a roadmap and it's intended to help you as the jurisdiction, as the retail food program, successfully navigate through the retail program standards. It's a flexible tool for you. The CSIP that you attach to your RFFM application will not impact your application review score. So the target completion dates that you list in your CSIP are just that, they're a target. The intent of developing a CSIP that identifies your individual leads and specific dates for each action step is to assist you with establishing your direction to map out your process to gain conformance with each of the retail program standards. So question number 2, does my CSIP have to cover all 9 retail program standards, or can we just develop a plan to address individual standards? The answer to this is yes, a CSIP should cover all 9 standards. Remember that the CSIP is based on the results of your completed self-assessment of all 9 standards, and it documents measurable continuous improvement with the program standards. So it should include all elements not met in your self-assessment, and it must identify the timeframes, the personnel, and other resources required for implementation. Your comprehensive strategic improvement plan must also specifically address a timeframe for completing a risk factor study or equivalent measure. Essentially, it's your written project plan that guides the work of your regulatory retail food program toward meeting the requirements of the standards not met. And additionally, your plan may also include tasks related to maintaining conformance with standards you already do meet. And then the last question is, do I need to have a CSIP prior to applying? So jurisdictions can apply for RFFM mentee funding under the development box prior to having a CSIP developed. A jurisdiction can also request funding under the development box to complete their CSIP. So keep in mind that CSIPs are important either with or without funding, and they're not a document that should be put together at the last minute. If a self-assessment has already been completed, a jurisdiction may choose to proactively develop a CSIP to ensure that they've got direction on their efforts to make progress within the program standards. And this can also help give them an idea where they may apply for future grant funding that could come available. On the other hand, a jurisdiction may decide to wait and apply for funds in order to develop their CSIP. So in summary today, we've taken a look at the purpose of the retail program standards and how they relate to continuous improvement in your retail food program. And we also defined a CSIP under the RFFM and explored how developing one will benefit your retail food program. And finally, we evaluated the elements of a CSIP when a CSIP is required for the RFFM, and we looked at some example scenarios. So if there are any additional questions, please continue to put those in the Pathable chat. Our team members who are on the line will assist with answering those as they come in. And then if we don't get to your question today, please remember that we are keeping track of all questions and are planning to send out a Q&A to all workshop attendees shortly after the seminar. And finally, if you think of something later as you actually start working on your own CSIP, you are encouraged to reach out to your retail food specialist as a resource. That concludes the presentation.
All right, thank you so much, Becky and Katherine. That was so much information. We have a lot of questions in chat that I'm still seeing, so please continue to add those. We will take a 10-minute break and we will come back and talk next with 2 other speakers. So hang in 10 more minutes and we will be back. Thank you. Just for clarification, it is a different link for each webinar. So you'll have to leave this link and join the next one on how to create a project implementation plan at the top of the hour. We'll also post this in chat. Sorry for any confusion.